Hey there, I am going to share with you something I did, or rather didn't do, during my clinical assessment that caused me to fail, and it's kind of embarrassing. My name is Nicole Whitworth, and I am the founder of Your Nursing Tutor. I help nursing students get through school confidently and calmly by teaching you the best strategy for how to study in a way that's going to train your brain to think like a nurse so that you don't have to rely on your professors. You don't have to rely on free YouTube videos. You don't have to rely on Facebook groups, and you don't even have to rely on me to identify the most important information and understand it. You will be able to do that for yourself, which is a skill you will use all the way through your successful nursing career. So I'm going to tell you the dumb little thing I did or didn't do that caused me to fail one of my clinical assessments when I was in nursing school. So you know how you get butterflies in your stomach and you feel really anxious before you go into the lab, and you're just not sure what skill, maybe you don't know what skill they're going to ask you to do specifically, or maybe you do, it depends on the school. I think ours, we had like an option. It was going to be one of three things, I think. And I got giving an IM injection. Pretty straightforward, right? At least if you've been a nurse for a while. But when you're in nursing school, everything seems, scary because it's all new, rightfully so. Anyhow, I went through it all. I cleaned the injection site. I made sure I probably injected some air into the bottle of medicine before withdrawing it. I had cleaned off the top with the alcohol swab. I was doing all the things. I thought I did fine. And then after the assessment at my school, they did this thing where you could, the professor would just ask you, is there anything that you want to like verbally correct? So it's basically giving you a chance that if you realized you made a mistake, you can correct it, and then it wouldn't count as much against you at the end. And so I was like, no, I think I did okay. And she's like, are you sure there's nothing you want to correct? And when they're saying that, you're just like, probably, but I don't know what it is. And she's like, are you sure you just want to think about it a minute? And I'm like, I can think about it, but I honestly can't think of what it would be. And she's like, okay, well, Nicole, I have to fail you because you didn't put on gloves before giving the injection. Don't. So because I failed to put on gloves before giving the IM injection to the baby doll in my clinical lab, I failed the first try one of my clinical evaluations. However, and this is why it's a good thing to know the policies at your school, which my professors did too, of course, so it was no problem. The way my school structured it is if you did one of the things that caused an automatic fail, because that's what it was considered since the personal safety precautions, if I failed to take the personal safety precautions, then it was an automatic fail for my clinical eval. But I was allowed to have a second chance to do it. And you can bet that I did not forget to put on gloves for that second chance. And so I was able to pass the second time through, and it was fine. Now it's a funny story. Then it was kind of embarrassing because I was the only peer tutor at my school. It was more embarrassing for me. Like, most people didn't care. I wasn't even the only student in my class who failed the first pass, although most people did pass the first time. And the ultimate thing is that I understood why, and that's not a mistake I'm ever going to make again. That's really what tests and exams should be. They should be learning experiences. You shouldn't have to focus so much on your grade. As long as you're passing, you should be using these as learning opportunities. And if you would like some help to use your exams and quizzes to get off of the hamster wheel of just barely keeping up and study it with the studying, and move instead towards using them as learning experiences because you're not afraid that you're 0.1% away from failing, then you should join me in my VIP tutoring membership, where I help nursing students do exactly that. Get off that hamster wheel of studying, stop feeling overwhelmed, and start taking control of your own nursing experience so that you do know that you are made for this. If you would like some more information to join me, you can find it at yournursingtutor.com/VIP.